We're kicking off the news at 5 o'clock today. Officially marks 1 week since the government shutdown began, leaving thousands of federal workers in limbo.
As we take a live look right now at Capitol Hill, we are learning the Senate has once again failed to advance a funding bill to end this shutdown. Thank you for being here with us at 5 o'clock. I'm Lorenzo Hall.
I'm Leslie Foster. Today's vote, again, predictable along party lines, 47 to 52, with 60 votes needed to move this forward. This stalemate between Democrats and Republicans all centers around health care funding.
And we can tell you tonight, one Republican lawmaker is not siding with her party tonight. Our Kelly Vaughn is live at the Capitol to tell us who and why. Kelly.
Well, the Democrats are refusing to endorse this temporary spending bill because it allows the Affordable Care Act subsidies to expire. And this is something that could raise insurance premiums for millions of Americans. But now Republican Representative Marjorie Taylor Greene, she says she has to go against her party on this issue because if those if those subsidies do expire, premiums could double in 2026. 24 million people buy health insurance through the Affordable Care Act marketplaces. More than 20 million of them use subsidies to help them afford coverage.
These are people who might not get coverage through work or don't qualify for Medicare or Medicaid. They're often people who are going through life transitions, like they just moved or just had a baby or might have lost their job.
Emily Gee is an economist and healthcare expert at the Center for American Progress. She says if the subsidies aren't extended, average premium costs would more than double nationally. Here locally, they ran the numbers and found that in D.C., premium costs would increase 57%, raising average premiums more than $1,000. In Maryland, premium costs would increase 154%, and in Virginia, they'd increase 167%.
There's one plan in Maryland that I saw that would go from about $600 per month to about $1,700 per month because of the expiration of the subsidies.
She says the increases could lead to some choosing to go without health insurance, especially if they anticipate being healthy next year.
It means that the overall profile of people with marketplace coverage is on average sicker, and it means higher premiums for everybody, regardless of whether they're getting subsidies or not.
The ripple effects could end up impacting everyone.
It also puts strain on providers, and so particularly for rural clinics, they're running on thin margins. And so if those hospitals and clinics are having to provide more uncompensated care, that could mean that we're seeing more rural hospital closures, more clinic closures, and that makes it harder for people to get care as well.
So Republicans are saying that these subsidies, they don't expire until the end of the year. So they feel this issue can wait. Let's get the government back open now. But open enrollment does start next month. So Democrats are saying we need to get these subsidies extended before millions of people try to enroll in health care on November 1st.
So many people impacted by these moves.
That's right, and we'll see if many more Republicans decide to break with their party over this, too.
All right, Kelly, thank you.